My name is Allison Gilstrap, and today, June 30th, I'm going to give an informative speech on dissociative identity disorder. To some people, the idea of having more than one personality living in the same body is alarming and mind-boggling, while to others it may seem like a superpower. People who suffer from dissociative identity disorder have two or more identities living in the same body. When a person goes through extreme negative situations, in rare cases their brain will develop more personalities to help them cope. When one personality is present, it is common that the other personalities do not know or remember what is going on. Dissociative identity disorder is a disorder many overlook involving one's memory. This is caused by ongoing trauma, typically at a young age, which takes years of therapy to correct. Many people are unfamiliar with the term dissociative identity disorder, or DID, also known as multiple personality disorder. In an article titled Dissociative Identity Disorder, Rebecca Frey explains, previously known as a multiple personality disorder, dissociative identity disorder is a condition in which those affected have more than one distinct identity or personal state. At least two of these personalities repeatedly assert themselves to control the behavior of the affected person. Each personality state has a distinctive name, past identity, and self-image. When symptoms of DID were first discovered before the 1800s, people thought that evil spirits were to blame. They thought that when a new personality was taken over, it was actually a demon taking over. As technology advanced, doctors were able to take scans of the brain of someone with DID. They were shocked to discover that each personality has its own unique brain chemistry. Each personality has different blood pressures, different allergies, different eyesights, different tastes, and different skills. It is extremely rare that one will develop this disorder. However, if there is enough trauma that this person simply cannot cope with, their brain will develop other personalities in order to help them cope. And in these pictures, we see a healthy brain on the left side of both of them. And you can see how enlarged the middle is on the people with DID, and that there's less activity with the people with DID. And then over here, you see the activity in the hippocampus and amygdala is much less in the dissociative identity disorder clients, which is the red, and then the healthy ones, which is the blue. Causes of DID vary but are commonly associated with abuse. Brady Phelps confirms this in his article titled Personality Theory, and Dissociative Identity Disorder, What Behavior Analysis Can Contribute and Clarify, by saying, reports of a history of childhood abuse are no doubt seen as the defining feature of DID in the minds of many clinicians. When one experiences abuse as a child, it is common for their brain to completely forget the memory in order to protect them from it. With DID, the person forgets the memory only because they did not technically experience it. Their brain creates alternate personalities which are more equipped to handle their situations, so when the situation arises again, they switch to that personality. There are two different psychological models that are used to explain the cause of DID, psychodynamic and behavioral. The psychodynamic model is the oldest and most famous of all the models. It focuses on underlying and unconscious forces, and the therapies are commonly centered around uncovering past trauma and inner conflict. The model says that DID is simply the result of lifetime excessive repression motivated by traumatic childhood events. The behavioral model focuses more on learning principles. Behaviorists explain abnormal functioning through different types of conditioning. This means that when momentary forgetting of trauma leads to less anxiety, then the likelihood of forgetting in the future is more likely. Behaviorists also introduce the idea of state-dependent learning. This is the idea that each thought, memory, and skill may be tied to a specific state of arousal. So in order to remember a certain event, you must be in the same state of arousal. They use this to explain DID. If you feel a certain way or like a certain person when you're being abused, you must be in the same state of arousal in order to remember it or feel that way. No matter which view you take on how the disorder developed, living with multiple personalities is dysfunctional and can even be dangerous. Many people wonder if DID can be treated, and if so, how. Unlike many other dissociative disorders, DID requires treatment. Therapists must take the time to bond with each personality and educate their client on their disorder. They hope to regain lost memories and integrate the personalities. In HBO's documentary titled Multiple Personality Disorders, narrator Michael Miradorf is explaining what is happening to a woman with DID during therapy. He says when altered personalities have memories and relive abuse, Gretchen herself gets closer to remembering what happened to her. With consistent therapy, there is hope. It may take anywhere from a few months to many years for all the personalities to be integrated, and when it does, the person can go on to live a happy life. Dissociative identity disorder, previously known as multiple personality disorder, is a very confusing disorder that many people ignore or deemed as made up. With the technology that we have today and our experts, it is more than obvious that it's a real disorder. The personalities that the brain develop are simply coping skills to deal with whatever trauma the person has faced. Although it takes dedication and a lot of effort for both parties, a therapist is usually able to help integrate all the personalities. DID is a very real disorder that needs to be understood and respected.